first semester of nursing school, there was a point at which I was sleeping only 4 hours a night. I wasn't getting together with friends anymore, and I was waking up already behind. If you're drowning right now, please don't click away, because I have 10 tips to share with you that can help you survive your nursing program too. I know it may look like my program wasn't as challenging for me, or that I may not remember as much of my program, but I can tell you that things felt utterly insurmountable as well then. Nursing school will show each and every one of you, like it did me, that you have so much to offer and internal strength that you may have never known that you had. Please stay with me to the end. Number 10 is the most critical and will determine your success outside the nursing program. Hi friends, it's April and welcome back to the channel. Please like, share, and subscribe. So, nursing school isn't impossible, but it is different from any kind of studying you've ever done in your life. Let me show you how I got through so that you can survive and thrive too. Tip number 1, acknowledge your learning style. I didn't fully appreciate what this meant until I got into the nursing program. So what exactly are we even talking about, right? Do I learn when people talk to me? Do I learn when I read? Do I learn when I hear things? Or is it a combination of the two? I'll admit I'd never really thought of it before. I knew that I learned pretty well when I read. I know that I learn and retain things even better if I actually physically do things. But I never really understood or thought about the fact that I don't learn as well or at all to some degree if I just hear things. So if someone asks me a question about a condition or medication, I have to write them down and then I can answer their question. Gaining this personal knowledge made it a lot easier for me to evaluate and tailor individual patient teaching plans. It really helped me have compassion and understanding during episodes of patient teaching for folks who can't read, and verbal instruction may be the only version available to do patient teaching. I have since learned, and there's been development over the years of like pictorial education, so that has been very helpful over the years. Tip 2, master the nursing test question. Nursing exams are a completely different species, don't we all know? They're not just testing knowledge. That's what we did before. Now we're moving on to testing clinical judgment, which means sometimes we look at multiple answers. Choosing the right one frequently comes down to what is the most correct answer. So it took a while to figure out how to evaluate questions like this, but when I did figure it out, it became crucial in prepping for the NCLEX. Here are some nursing prioritization models that can help narrow things down a bit. Obviously, we always start with our ABCs, airway, breathing, and circulation. Patient safety is also huge for NCLEX, and we always want to start with the least invasive interventions first. Maslow's hierarchy of needs is another. I did a different video on Maslow's hierarchy of needs, so I'll put that at the end of this video if you want to take a check. If a patient has an airway problem, for example, and another has pain, which one are we going to go see first? We're obviously seeing the one with the airway problem, right? Once we start recognizing these patterns, test questions stop feeling random, which is really nice. They become predictable. Tip 3, don't study alone all the time. I know we're all different and some people like to study alone, but nursing school is one of the few programs where studying in groups did actually dramatically improve my personal learning, and it does for lots of others. I'll address this a little later in the video as well. I had a specific study partner that we would take different roles. We would start with one person being the teacher and about a concept, and the other person would be the student. And frequently, the student would remember one small portion of the concept that the teacher had forgotten. By saying that bit of the concept, it would assist the teacher and it would make it so that we would both retain the entire concept. And then for the next concept, we'd flip it around and the student would now be the teacher. The rule in learning in this manner is called the Feynman technique. You can teach something simply, you understand it. If you can't, you don't, which is helpful because you now know you can either move on to the next thing or it's time to do a little more review. So you find 2 or 3 motivated classmates, not 10. People who actually want to learn. I really also want to stress that you may want to pick learning buddies that learn the same way you do. It just might make it a little easier. You can quiz each other on disease processes, nursing intervention, and priority questions. You'll be shocked at how much faster everything starts sticking, which is also really encouraging and does a lot for the self-esteem. The priority questions and disease process, all of that beyond nursing school turns out to be very, very effective when you're getting to go for your first new grad job interviews. So just something to keep in mind. Tip 4, clinicals are where the real learning happens. Here's something most students don't realize until later. Your clinicals matter just as much as your exams. I absolutely believe this, and they might matter even a little more. Because here's where the textbook knowledge meets real patience. During clinicals, ask questions constantly. Ask everybody. Watch how experienced nurses think. And when you go home after clinicals, write down what you've learned that day. It might be a new medication, a patient, a skill you've observed. This reflection turns every clinical shift into a powerful learning experience. Reality shows that patients will rarely look like the exact pictures in our books. So while they provide an excellent foundation, we need to be able to be flexible and observe the whole patient. Tip 5, stop writing notes. I did this at first and didn't help me at all. All I did was give me wrist pain. Instead, I focused on active recall. This means forcing your brain to retrieve information without looking. The version that worked best for me is flashcards. It always has. The benefits of this is that they can be used alone or with a partner. So 2 can be learning. If that doesn't sound like it works for you, don't worry, there's other types. Try, again, practice questions, teaching someone else, or drawing concept maps. If your brain works with color, try doing your concept maps in color. That makes it a little more fun. Active recall is uncomfortable, but it's the fastest way to learn complex material. Tip 6, time management will save you. Nursing school is just academically challenging, I assure you. It's also time management to the extreme. So when looking at lectures, clinical shifts, exams, care plans, and skill labs, my schedule looked beyond insane. The trick is to planning them only a week at a time, okay? Just 1 week at a time. Every Sunday, I sat down and asked, what exams are coming up, what papers are due, and what topics do I need to look at a little more. Then I would block out the time on the schedule. Because if studying only happened when I felt like it, I don't think you want to know about that. It probably wouldn't have happened very often. Tip 7, practice questions are your secret weapon. If there's one tip that completely changed my performance in nursing school, it's this. Practice questions, lots of them. This is one of the places your study buddies comes into play. Our brain learns best when it practices thinking like the exam. I got some questions wrong, but that's okay because I was still training my brain to think in patterns. I found question banks, NCLEX practice exams, and reviews to be helpful. And here's the key. I knew that checking the wrong answer and moving on wasn't the way I was going to learn. I reviewed why I had answered the question wrong, and that helped me memorize the correct answer so that when I saw a question like that again, I wouldn't answer it incorrectly. Tip 8, take care of your mental health. That is like a recurring theme from now through your whole nursing career. Nursing school has a reputation for being stressful. I'm sure you've never heard that before. It surely is. But burnout doesn't make you a better nurse. It makes everything harder, and it shouldn't have to be harder. So protect your mental health. Sleep matters, exercise matters, taking breaks matters. You cannot pour from an empty cup. You'll hear that a lot. Even something as simple as going for a walk, calling a friend, or taking a real day off can reset your brain and help you come back stronger. Tip 9, remember why you started. We all have had moments in nursing school where we've questioned everything. A bad exam, a tough clinical shift, a day where nothing seems to stick. When that happens, remember something important. You're not studying for a grade. You're preparing to care for real people. Patients are scared. Families need reassurance. Lives that will eventually depend on your knowledge. That purpose is bigger than any single exam. Now, number 10, remember I mentioned there was one critical thing that you could do to prepare yourself as a new grad nurse? Here it is. I know that this is true because I did this myself. Not because it was easy for me, believe me, not easier than anyone else, but as I knew that the patients were aware I was a student nurse and they had more patience with me. Take every single opportunity to start IVs, put in Foley catheters, do compressions during a code, put in NG tubes, anything and everything you possibly can. You will be uneasy too, but it will make you more comfortable when you're on your own, and believe me, your patients will feel it too. So if you're about to start nursing school or you're already in the middle of it, remember these tips. Accept how you learn. Learn the logic behind nursing questions. Use study groups strategically. Learn from clinicals. Focus on active recall. Manage your time. Practice NCLEX style study questions. Protect your mental health. Remember your purpose. Take all opportunities available, because the journey may be tough, but the impact you'll have as a nurse is worth it. If you're a nursing student watching this, please drop a comment and tell me what semester you're in. Thank you for being here with me today. And I've put the video from Maslow's Nursing up here. I hope to see you again soon.